What is up, YouTube? Today we have a special episode for you guys in which we're going to talk about nutrition and its relationships to dentistry. So here I have my cousin, which he's studying to become a dentist. Same way I'm studying to become a dietitian. I am currently in the midst of my internship and I'm on my last month. And how long do you have to?
I got 6 months left. So it's been, all of undergrad and 4 years in dental school. Finally now, almost coming to an end.
Then you have to take an exam after that, or you already?
So at least the way that my school does it, we take our board exams within our education. So we don't have to waste more time afterwards studying.
Yeah. So we'll just cut off right to the chase. So when people think about your oral health and your dental health, you're usually told to brush your teeth, to do other things, but rarely is nutrition ever spoken about. So that's what I'm here for, and my cousin's here for, and to enlighten you guys on the relationship in between the both. So before we even start, how many times should you brush your teeth a day?
How many times should you brush your teeth? The right answer is after every meal.
Makes sense.
The best way if you want to be super on top of your hygiene after every meal. So that way you don't need any food there to start fermenting and start being used up by the bacteria to, keep feeding those.
What about snacks?
Snacks? What about them? Like, when should you brush after snacks?
Yeah, should you, but does that include, because you said meals, does that include snacks as well, or?
Right, I mean, yeah, the ideally you don't want to leave any food in your mouth for extended periods of time. Obviously, how realistic is it to be brushing after every snack? Not realistic at all. So, that's why I'm saying the right answer, you want the textbook answer. Yeah, putting food in your mouth. But realistically, if you can, after every meal, at least if you're going to work, sometimes it's difficult, but you can take a little toothbrush with you, or minimum, take some xylitol gum.
Xylitol. So xylitol, for you guys that don't know, is an artificial sweetener. And in the nutrition world, that's a hot topic of artificial sweeteners. Are they good? Are they bad? Typically, I think it's very overblown, like the fear behind it. Obviously, there's better artificial sweeteners than others, like monk fruit, stevia, and then the ones you'd want to limit are like aspartame and sucralose. However, xylitol is a specific artificial sweetener that actually has some benefits for the teeth. What are those benefits?
So the main benefit that it has is that it has antimicrobial properties. So while you're chewing the gum, just as you would with any gum, so you can have regular sugar-free gum with aspartame, or other synthetic sweeteners that all you're doing is saving yourself from the 5 calories that you would from chewing gum, which really how much does that affect you? But anyway, if you're going to be using an artificial sweetener, use xylitol, and then you're cleaning your mouth at the same time. When you're chewing gum, that gum is able to get into places, tight spaces in between teeth.
Like those little crevices.
The little crevices, which is where food gets trapped. So if you're having sugared gum, in that process, you're getting all that sugar inside those crevices. And now you're feeding the bacteria that live there. The bacteria that lives in the mouth feeds off of sugar, being carbohydrates or just plain sugar. So if you, instead of giving that bacteria sugar and you introduce xylitol in there, you're going to essentially be killing the bacteria and cleaning your mouth in the process.
And I'm not sure if I'm right, but I believe does it also help with the bone mineralization, or am I just making some stuff up?
The xylitol, it helps not with the bone remineralization, but the tooth remineralization. But that's more of fluorides properties.
Got it.
Not so much the xylitol.
And for what you're talking about of bacteria living inside your teeth, does more bacteria live in someone with loose teeth or someone with tight teeth?
So somebody who has loose teeth, at that point,
loose by that there's a lot of space, that there's a lot of space. Yeah.
But they're stable. They're not.
Yeah.
Oh, okay. Well, it all comes down to hygiene at the end of the day, because you could have it. I've seen from my experience people with a lot of messed up teeth and they just don't brush. and they have way more disease in the mouth, bacteria building up, more cavities, and somebody with tighter teeth who just has a good oral hygiene techniques, and they implement them, and they follow through with it, and they have, you know, excellent oral health.
Mm-hmm.
So it all depends, and there's both extremes. There's also people with tight teeth with terrible oral hygiene.
Mm-hmm.
It all comes down to the hygiene is what it does. Obviously, having tighter teeth makes it more difficult to get into those spaces. The food traps easier because it can't just flow in and out. The food gets stuck, and now you have to do more of an effort to go up and clean it out.
Mm-hmm.
But at the end of the day, if you brush correctly, there's no, you know, you can maintain a good oral health with tight teeth or with separated teeth.
And what about mouthwash? Like, how important is mouthwash, or like, is it overrated, or?
It's pretty good. It's pretty good. It's obviously supplemental. It's not, oh yeah, today I don't feel like brushing my teeth, I'm gonna just rinse out with a little mouthwash. The biggest reason why that doesn't work, even, it's not that it's not as good. It won't work because you need to mechanically remove all of the plaque. There's so everything goes back to bacteria, lives in your mouth.
Mm-hmm.
It's the cause of periodontal bone loss, cavities, the plaque behind it. All of that is due to the bacteria that's there and the debris, and the debris feeds the bacteria. So the bacteria, they come together in the mouth and make what's called a biofilm, make like a layer, a slimy layer that covers. So I don't know if maybe you guys feel this when you don't brush your teeth for a while. You can feel like a little skin over it. Sometimes it's kind of raspy, and just feeling your on the top of the teeth. It doesn't feel, you know, your
It doesn't
clean
feel,
teeth feels like, and it doesn't feel like that after you brush. So that all of that is essentially living bacteria. You have to remove that. So then the mouthwash could even do its effect. So the mouthwash typically has fluoride, which helps with the remineralization of the teeth, strengthens the enamel. But it can't do that if it can't contact the teeth.
Mm-hmm.
If you still have the layer of bacteria on the teeth, the fluoride will never touch the tooth, and it's already did nothing.
And I know that most mouthwashes like Listerine, they have alcohol. And from what I know, that you want to have like a moist mouth with saliva, and alcohol dries out. So, with that being said, would you say like a alcohol-free mouthwash is better?
100%. Alcohol-free is the way to run. Listerine, regular green Listerine has alcohol.
Yeah. I think they drink that in prison, right? Yeah.
Some people drink it to,
It's a drug.
get some ethanol.
Yeah.
But yeah, alcohol-free is the best, because also the alcohol will also lower the pH in the mouth, will make your mouth drier.
Yeah.
And it's kind of counterintuitive to what people think, like, oh, alcohol cleans, gonna clean my mouth with it. It makes complete sense. But there's more to it than just cleaning the mouth.
Mm-hmm.
It's a whole holistic view of everything. If you want to keep it moist, you want the pH to be there. You won't stop the saliva flow, because the saliva is the number one determinant of how healthy your mouth is going to be. If your saliva is acidic, if it's thick, not cooling as much as it needs to, your chances of getting cavities goes way up.
Mm-hmm.
So you can help that out with the mouthwash. You could even have, if you have dry mouth, like you suffer from just chronic dry mouth, there's certain mouthwashes that help stimulate the salivary production, or even just a saliva replacement.
Like biotine, right?
Yeah.
Biotine. And I know, like in the oncology setting, because I've done my internship at Miami Cancer Institute, that the cancer patients, a typical side effect is called xerostomia, which is like a fancy way of saying dry mouth.
Right.
But with that like once they get that, then their oral health like goes down tremendously. So for all you people that have had like a lot of saliva in your mouth, and you probably like have a lisp and things, just know that you're lucky, like compared to someone that has dry mouth, because it's not good. And we also like prescribe something like magic mouthwash.
Magic mouthwash.
So that's more of like for like cuts or something, I think.
It's yeah, and also especially
Yeah. Oh no, never mind. That's something different.
well, yeah, no, it treats thrush too. So in the hospital setting where you're seeing it, most of these patients are severely their health is compromised, and they have autoimmune disorders, and they're taking a lot of corticosteroids to help with their cancer treatment. And so, for example, corticosteroids. So a patient who's taking steroids for treatment, a big side effect from that is thrush. They get thrush in the mouth from using steroids. So then the magic mouthwash, what it does is a concoction that they make. It has to be prescribed. You can't get this over the counter.
Yeah.
Has to be prescribed by the doctor. But what they do is a concoction of nystatin usually, or some type of antifungal, or fluconazole, different ones. But typically nystatin they use. They use other fluoride. They use and other components that help kill whatever microbe is in the mouth, if it's fungal, bacteria, or just like it also has anti-plaque properties. So it helps clean the mouth. It helps clean it from fungi, from bacteria, whatever it is that may be causing it. It's more of a broad spectrum cleanser for the mouth. Instead of targeting one thing specifically, because most of those patients have different things affecting them. It's not just the fungus that's giving them chances are it's not just the fungus that's affecting them.
Yeah.
So have a lot of bacteria that has to be addressed. So they just do it
And
that mouthwash.
And back to where you're talking about of like sugar building up in the teeth. With that being said, would like a low carb diet be like the best diet to avoid? Not like just for oral health.
Yeah, if you just want to break it down to black and white, yeah. If you can, the more you can stay away from carbs, the better for your mouth. Again, how realistic is that?
Yeah, because carbs are not bad for you guys. It's just like the sugary, like, the high sugar, like sticky, gummy foods that are the bad ones. So you don't be a carbophobe. Don't be afraid of carbs. But like, if you do find yourself paying a lot in dentist bills, because I know how that feels like, maybe that's something that you could look into. Obviously, consult with your dietitian before doing a low carb diet, because if you don't do it correctly, you could like experience fatigue and headache, a bunch of other things. But that's another topic. And how about like homemade like mouthwashes, like hydrogen peroxide? Would you advise against that? Like,
no, I wouldn't advise against it. Just to take precautions. Know if you're going to be making your own mixes and stuff, be aware of what it is that you're using. For example, peroxide. If you're going to be using hydrogen peroxide, dilute it with water. Is the biggest thing, because most people see hydrogen peroxide for whitening, that they have hydrogen peroxide on the whitening strips. Screw it, I'm just going to take a capful and swish with it. It's okay, it's not bad, but the thing is, you get chemical burns. There's a high chance of getting chemical burns from hydrogen peroxide. So what you want to do is dilute it with some water, so that the content of peroxide is not as strong in your mouth.
And it burns because of like its acidity, right? Or
it burns because of the enzymes. It literally starts breaking down the protein. Down the protein, and it's burning your skin. When you see it fizzing, that the hydrogen peroxide, when you see it fizzing, it's literally breaking stuff down. Yeah. So that's why you use it to like clean a wound. You're taking all of that mucosa that's there and breaking it down. Same thing's happening in your mouth, but on tissue that you don't want to break down. Yeah. Perfectly healthy.
So if you mix it with baking soda, would that help?
It could help too, but you still want to dilute it, because it's not just the baking soda. You want to dilute it. And the biggest thing about hydrogen peroxide is that it dries also. That's the main thing about it, is that it takes out any humidity from it. Again, that's why you use it on wounds. When you put it on a wound, you don't want the wound to be moist, because that's when it starts getting green. It starts getting infected. So if you take out the moisture, you're not feeding that bacteria. The whole name of the game is to make it uncomfortable for the bacteria. You don't want the bacteria to be comfortable in any environment that's in your body.
Mm-hmm. That's why you guys have to floss.
Yep.
Because that breaks up the bacterial flow in between the teeth.
Mm-hmm.
And so speaking about that, like, what do you think about those floss picks? Like, because I love those things. Like,
they're good. More than good, they're convenient.
Yes.
They're convenient because you don't have to, sometimes the floss, it's weird to get the right angle, to have enough pressure to go through the teeth, through the space on the teeth. But, and then so that gives you a good angle to work with. The biggest con of it that I can say is that you can't slide out.
Yeah,
floss.
you can.
So the right way, typically when people think of flossing, is in and out. But the right way to do it is floss in and you pull it out through the side, so that way it takes out all the food on the side. Because if you're pushing back up, you're jamming that food, but you just moved out from the tight space. You're shoving it right back into the space where it came from. And you move it, and of course it's better than not doing anything, but you don't get the full effect from it as you would with a regular floss.
Can you dip your floss in hydrogen peroxide, or that's just doing too much?
That, I probably wouldn't do that.
Okay.
Because when you floss, you want to get under the gums.
Oh, yeah, and then you don't want to, like, burn that tip.
Yeah, you're going to be getting, and you have a lot of fluids inside the gum, the gingival crevicular fluid, the GCF, we call it. So that fluid, it lives, or it's made inside the gums that is right around the teeth. And that literally feeds the roots, feeds the teeth, and that's also part of the saliva, what makes up your saliva, to keep that environment healthy and at a good pH. So you don't want to be affecting that and drying that up with the peroxide.
Oh, okay. And I'm a fan of coffee. I'm a fan of wine.
Me too.
All these things cause staining. So this is my protocol, is as soon as I finish drinking some coffee, I just swish around some water and baking soda in my mouth and spit it out. Like, would that help, or like?
Yeah, it helps. It helps. As long as you're not brushing afterwards. So a big thing that the knee-jerk reaction of somebody that wants to have an immediate change in their oral health is, I'm going to start brushing after everything, but especially for coffee, if you're having soda or tea, anything, all of those types of drinks, anything sugary or acidic, drops the pH in the mouth. All of this, I feel like I've repeated pH like 1,000 times, but that's because it's pretty much like the two biggest things that affect oral health is what is the pH in your mouth and how much bacteria is living in there.
So wouldn't, like, putting baking soda in your mouth help the pH, because it, like,
raises some more alcohol.
Okay.
Raises the pH.
So, because sometimes I do this, I just, like, I dip my toothbrush in some, like, water with some baking soda, and I just, like, I don't scrub it, I just, like, leave it on my teeth, like.
Yeah.
Okay. No, I just wanted to make sure
I can't say that, I've read studies on it and that I know for sure, but I don't see why not. I would have to see what the studies say on how effective is it versus, just using regular toothpaste afterwards. Like, I don't know.
So this is not a formal recommendation.
Yeah, it's not a formal recommendation. You could try it for yourself and see if it works for you.
It's the same thing in nutrition when, like, I have a patient asking me about something that is, like, common sense, and when it's like, I don't have, like, the studies for it, like, exactly. I can't, like, so you always have, like, as a professional, you always have to tail on the side of caution. So
exactly.
If you guys did that, like, put baking soda in your teeth and die, like, we have no liability for you guys. So So I remember you told me when you wake up in the morning, and usually people brush their teeth, then have breakfast.
Yeah.
And you said to not do that because, like,
no, that you can do. That you can brush your teeth and have breakfast after.
You just have to wait, like, a while.
Like, if you brush before, there's no issue. The issue is when people eat and have coffee, and then want to brush their teeth after, that's where the issue is. Because
Oh, I thought it was before. Okay, never mind.
no. So it goes back to what we were just talking about. When you have something acidic, so say you had coffee in the morning, or you had like orange juice, which is, it could be acidic, that pH in your mouth drops, and the enamel lives in a healthy pH around like 6, 7. Once your mouth goes below 5.5 pH, meaning that's it. Anything lower than 7 is acidic on the pH scale. So once your mouth is in an acidic state, that enamel gets a lot softer. And then what happens when you are brushing in that period, you would want to wait at least 40 minutes to an hour, ideally on the higher end of it, to wait for that pH to come back to stability. Because if you're brushing your teeth during that period where the pH is still low, toothpastes are very abrasive. So they have compounds in there that help you scrub your teeth. Like the actual toothpaste has little particles. You could think of them like sand particles, but it's not sand. It's
Yeah, abrasives. Yeah.
abrasives. So if you're using that, that's the abrasive that you want to help brush off that biofilm that we're talking about. But if you're using it while that enamel's still soft, when it's still acidic in the mouth, what ends up doing is you're literally wasting away the teeth. You're sanding down your actual teeth because they're so soft. When the enamel is fine, your teeth are strong enough to sustain that mechanical abrasion that you're literally putting them through, which is just toothbrushing. But again, when the mouth is acidic, your teeth are a lot more susceptible to being eroded by mechanically. And then you really want to watch it, because if you leave your mouth acidic for too long, it also starts like burning away the teeth, essentially, when the mouth is too acidic. And you see this in patients that are chronic tea drinkers, coffee drinkers, soda drinkers. Soda's a big one, because people, especially people that will go all day without drinking water, but they drink soda all day. Now they're keeping their mouth in that acidic environment the whole day. That mouth never even went through the period of an hour where you wait and then after an hour it's back to regular pH, because they never stopped drinking soda.
Soda also has phosphorus, which like it's not good for the teeth either.
And so you can see it. You can see patients, they open their mouth, and just by looking at it, it's like, all right, so I know this person either drinks coffee all day, which is and then the most likely, but coffee, you're probably not drinking it all day. Coffee, you'll probably drink it, a couple times a day.
Three times a day. Yeah. For me.
But chronic soda drinkers will drink soda the whole day.
Yeah.
And that's the dangerous one, because coffee is more of...
You have to come out with a xylitol soda. On Shark Tank, you heard it here first.
Xylitol soda.
Yeah. So...
Xylocola.
So, yeah. Yeah, you're saying, my brother, like,
No.
cut you off.
I don't think
So avoid like soda and electric versus manual toothbrushes. Which one?
I would suggest manual.
Manual. Oh, okay. That's interesting.
I would suggest manual, because what happens with the electric ones can be good if you know how to brush your teeth.
Okay.
What happens most of the time is people get an electric toothbrush. I bought $120 toothbrush, and you think the toothbrush is going to do the cleaning for you. You just put it on the tooth, I don't have to tape it on the surface. That's not even everything that it's supposed to do. Wrong. That toothbrush is not going to do anything extra unless you do the motions that you have to do on. So if you have a good brushing technique that you establish with your manual toothbrush, and you keep doing that with the electric one, sure. But you could just have a 99-cent toothbrush and have a good technique of brushing and get just as much of an effective result out of it as you would an electric toothbrush that costs you $150.
Well, mine didn't cost $150. Or I know what you're talking about. But like my experience, I would get cavities a lot, and as soon as I switched to
electric.
It's probably a good technique, but I think I was advised to, when you brush, to have it like pointing towards your gums. Like,
Yeah. So when you start, you want to be. I wish I had something to demonstrate. Here, I have a type it on a model of teeth. So you want these bristles to start inside the gums, and you brush away from the gums. You get in there so that you can clean. Food does get trapped inside the gums. It's not just, you don't just brush like this straight through. It's more of an individual.
it's like a flick, right?
Or flick it. You flick it off. But don't think of, I'm going to clean my teeth. And people just go and brush everything. Just, okay, I'm going to clean this tooth very well. This tooth I'm going to clean very well. And you take it 2 teeth at a time, a tooth at a time. And you get in there. You can even get inside the spaces with the brush and brush off and brush off, brush off. Something else very good is even flossing before you brush.
Yeah, because I would floss after. Okay.
So the thing about that is the toothpaste, like we said, it has fluoride. The fluoride helps remineralize the enamel. So when you're flossing, you're removing that bacteria that's covering the tooth. You don't remove that bacteria in between the teeth until you floss. So if you're brushing and you brush the outside part of the teeth, meanwhile, in between the teeth, that bacteria is still there. So none of that, the inside of the teeth, ever saw fluoride. So that enamel stays soft and exposed to bacteria. And then when you floss, that's it. You took it off mechanically, but you never helped remineralize it. So even better, if you want to have the best oral hygiene technique, you floss first, then brush, and then you use the mouthwash. And a mouthwash that I like to recommend is ACT. It doesn't have alcohol. It has a very good fluoride content. And honestly, most of the patients that I have that I suggest, all right, start using ACT. You know, we get their whole mouth and back to stability, back to oral health, and we start implementing a more effective oral hygiene technique with ACT and with the right toothpaste for them. These patients don't have any cavities anymore, and they were chronic. What's the right terminology? Like
frequent flyers that they would always like.
Frequent flyers, yeah, would be a good term, but it's chronic recurrent decay is like they constantly have recurrent cavities, and even a cavity that they got filled because of how bad the hygiene is, cavities start forming in that same filling that they just had. It's not supposed to, but if you make it a super nice environment for the bacteria is just going to keep hanging out there.
Yeah.
Keep making their home.
And what are the most common nutritional deficiencies in people that have very bad teeth? I'm gonna throw out a guess. I'm assuming vitamin C, because I remember with scurvy and
vitamin C, vitamin D, believe it or not, is a big one. So even
I believe it.
even getting sunlight it's incredible how much of an effect that has on your teeth, because vitamin D is what helps you.
Make sure you guys click on my video on sunlight.
But vitamin D is what helps you retain the calcium, and just your bones, your teeth is made from calcium. If your body isn't able to absorb the calcium, meaning you don't have vitamin D to help absorb the calcium, your teeth are going to be in bad shape. Chances are your bones might probably be in bad shape too. You might want to get checked out for osteoporosis or any other bone deficiencies that might be happening. So vitamin D is a big one. And then calcium, but those two go hand in hand. Vitamin C is important, and really everything. It's oral health. People see it as two different things, health and oral health. And is your teeth in good shape, and is your body in good shape? But it all goes together.
Yeah, because your teeth are bones, and then your gums are tissue, and it's literally a part of your body. Yeah.
The best way that I heard it being described by a doctor, your mouth is the top for the beginning of your digestive tract.
Yes, it is.
So people talk about, oh, my stomach, my intestine. Okay, yeah, you have issues with that, but it all starts with your mouth.
Digestion, starts in the mouth, and the first part of the digestion process is the saliva breaking down the food. So your mouth is like very important. And I know if people have a lot of oral cavity issues, that it also like stems down like the disease to other parts of the digestive tract as well. Am I right? Or?
100% right. 100% right. And again, we go back to the saliva. If you have xerostomia and you're not producing enough saliva, you're not breaking down the food like you need to. So when you send off, it's all a factory inside your body. It's a factory to break down the food that you're giving your body for fuel. Mm-hmm. They break it down and disperse everything where it needs to go. And that process starts in your mouth. You have the enzymes that breaks down the carbohydrates. You're breaking down the proteins. If you're not producing that, by the time it gets to your stomach, now your stomach has to do overload. Your intestines has to overload. By the time, and your liver has to overload. And you put a strain on your body that then people go into, they start developing GERD. The liver goes.
Yeah, GERD for you guys is acid reflux.
Acid reflux, heartburn. And that.
So also maybe that's why they say smoking causes GERD. Maybe that's a pathway. Like
smoking causes GERD because, so smoking makes the
saliva thicker, or
it makes the saliva thicker. It causes dry mouth because you're literally putting smoke. So smoke in general dries things up. So you're drying up all of the saliva in your mouth, and when it goes to the throat, even though say, it's a cigar, they puff it out, but still when it gets to the throat, it's burning the inside of the throat. It's hot smoke.
Mm-hmm.
So you're burning. Now you have the inner lining of your esophagus is burnt off, essentially.
Yes.
Now, when you get any moment that you have acid reflux, so just because you got acid reflux doesn't necessarily mean you have, like chronic GERD or like it's bad. Sometimes you just, something came up.
Yeah.
But if you're a smoker and something came up, you're burning more with acid. And what comes out from acid reflux is stomach acid, which is super acidic. It's more acidic than a Coke, than all of these things that we've been talking about.
Yeah, that's why bulimic patients, they have like messed up teeth because they're constantly like throwing up vomit, and that goes on their teeth, and they just have terrible
mm-hmm.
or like oral health.
Yeah. And so you bring up vomiting, same thing, which it's kind of nasty, but for a bulimic patient, if they brush after every time they vomit,
it's even worse.
They're wasting away their teeth because it's extremely acidic. And you see that. You see bulimic patients have extremely eroded teeth. A lot of them have their teeth to the gum level. The teeth are not the regular height of teeth anymore. They literally wore them away. And it's gum on gum, but you see remnants of teeth still there. They got burnt off by the acid.
Mm-hmm.
And then scraped off by the toothbrush while it's still acidic. So it's crazy. It's crazy how you see all of that manifest in the mouth.
So that's a great point that you brought up. So we live in Miami, and it's a place where a lot of people get a lot of treatments done. They get like their BBL, but now the new advent is the veneers. So if someone has messed up teeth and they get veneers, are they saved?
Are they saved? So it's
you're not saved.
Well, so it's a very complex. It's not a black and white answer. Are they saved in terms of like, I don't like my teeth, I like my teeth now?
Well, are they saved like in that sense of like will they get cavities? And
a lot of times veneers makes a person more propense to getting cavities.
Ooh. For all you guys that think that you could spend like $16K, and I think even more, right? Like
yeah. Some people can end up paying $40,000 for the teeth, and it's not. You get veneers, you're gonna get cavities. That's not what it means. But if you do get veneers, you decide to go through with that, and for some people it changes up, man. It's convenient, and sometimes it goes so the only solution. You want straight teeth. You got straight teeth, but your teeth are still ugly. You have ugly straight teeth. So some people want to completely change the way that their teeth look, and that's fine. Completely understandable. If you have the means and you can do it, do it. But you have to be on top of your oral health. If you do decide to go through with a cosmetic treatment like veneers, crowning all your teeth, because now, how would you say it? Like exposed. You just ground out a lot of healthy tooth structure enamel to be able to put that material on top of it. Depending if you did a porcelain veneer or a composite or whatever material it went through with. When you take x-rays and you go to the doctor, to the dentist for your checkup, and they take these x-rays, now that you have this veneer material on top of your teeth, the dentist can't see through it. On the x-ray, it comes up a lot. We call it radiolucent. So it shines a lot brighter than it would regular tooth structure, and it covers the tooth structure. So now we can't see if there are cavities or not. Can't even tell. So a lot of times when people are replacing their veneers, like, oh, I'm not happy with them anymore, or it's been 10 years already, I want to get it changed. When you take off those veneers, there's a lot more decayed under that than what you could have seen from the front, because you can't see the tooth anymore. It's covered. You can't see on the x-ray anymore because it's covered on the x-ray too. So it's almost completely up to the patient to maintain their oral health at home, to go in regularly for their cleaning treatments at least every 6 months. I suggest if you have veneer treatments and you have, or like a full cosmetic treatment in your mouth, or a smile design, like people like to call it, maybe even go more often than just the 6 months for your cleaning. Go every 3 or 4 months for those cleanings, because of the fact that you're more propense to getting cavities.
Interesting. No, I didn't know that. And man, here making me want to floss right now and brush my teeth. So I think we're just gonna wrap it up here because I need to get brushed off. You have any questions for me before? I guess not. So where can we find you? On Instagram, you could follow him at Dr. Bibilonia. And where else can they? Do you still have the YouTube channel or?
No. I haven't been on.
No, dental. Oh yeah, I can imagine.
No Facebook, nothing. At some point, and I forget if it was my first or second year, I closed up shop, everything. I remember all the social media closed down. That's it. Zero distractions, zero. Just had to log in on school. So I made my Instagram now. There's a lot of interesting stuff going on in the dental field that with technology now. A lot of doctors doing very cool procedures, innovative stuff, and they post it on Instagram. It's incredible now how much you can learn in social media if you're using it for the right things.
Yeah, not just seeing people twerking and
not just people twerking and doing stupidity.
Yeah.
You could learn a lot on social media. So I mainly have it for that and to connect with colleagues and other people in the field, But yeah, not too much else going on.
Okay. So check him out on Instagram at Dr. Bibilonia. And Hector, it was a pleasure to you.
It was a pleasure.
And hope you guys learned a thing or two. Make sure to subscribe to my channel and peace.